Hey, hi, my name is Tatiana, and today I'm going to be presenting on the medications, therapy, and social work best practices in mental health. So, medications play a vital role in mental health. They help reduce symptoms, improve day-to-day functioning, and then they can also lower the relapse rates, especially for the conditions such as depression, anxiety, and bipolar disorder. However, there are more limitations that are important, and medications can also cause side effects. And many individuals struggle with staying consistent with taking their medications that are prescribed. It is also important to remember that medication is not a permanent solution. It does not address the deeper social and personal challenges that underlie in mental illnesses. And a takeaway here, medication alone is not enough in order to receive the best outcomes. It's recommended that we pair it with therapy and strong supportive systems. So when it comes to anxiety and trauma related disorders, they're both medication and therapeutic interventions. For the medication, selective serotonin reuptake inhibitors, such as Serotin and fluoxetine, are typically the first line of the treatment. And then we have serotonin and non-europterin reuptake inhibitors, such as the venlafaxine, and are another option. For traumatic stress disorders, we have prazosin, and it can be effective in reducing nightmares. On the therapy side, we have the cognitive behavior therapy, which is considered pretty much a gold standard for anxiety. And then the post-traumatic stress disorder approaches eye movement desensitization and reprocessing trauma-informed cognitive behavioral therapy. And then for the bipolar and other mood disorder, medication is essential for common mood stabilizers, including lithium and valproate. And antipsychotic medications such as quetiapine and loracetin are often added, especially for bipolar depression. But we also see alternative interventions such as family-focused therapy that helps both the family support the individual and the prevention of relapse, and then also the psychoeducation empowers clients to understand that their illnesses improve treatment adherence. For schizophrenia, typical antipsychotics such as risperidone and olanzapine are standard treatments. Clozapine is reserved for the treatment-resistant cases, and then supportive services such as skill training and supporting employment help improve long-term outcomes. For personality disorders, especially borderline personality disorders, medication have limited impacts. Some individuals may use selective serotonin reuptake inhibitors or mood stabilizers for specific symptoms, but the strong evidence supports dialectal behavior therapy. Social workers have a key role in medication related care as we monitor the effects on the treatment adherence, making sure that the clients take medication safely, providing psychoeducation so the clients understand which medications they can and cannot do. Also, the coordination of care and working really close with psychiatrics and other providers, but most importantly, offering holistic treatment, considering client culture and the preferences and overall their well being. For the National Association of Social Workers Code of Ethics, it reminds us to promote promoting fair access to care, engaging in policy advocacy, especially around mental health legislations, and then also ethically during crises and effectively fighting the stigma. At the same time, we must be aware of the systematic issues, um, and we'll address them here for the pills mill. They're clinics that drug mainly to take away, which would cause addiction and misuse, over medicating, using medications as the only solution without supporting therapy or counseling. And then the big pharma drug companies sometimes influence what doctors prescribe and how the health policies are shaped. And the influence of large pharmaceutical companies on prescriptions and the health policy. And as social workers, we need to ensure that the treatment is ethical, effective, and centered to the real needs of our clients. So the final focus here, we're going to take a closer look at bipolar disorder. While medications such as lithium are effective, they also come with side effects, creating weight gain and also potentially kidney risks. And adherence is a common challenge. And this is where we come in with the family focused therapy, and it improves medication adherence, reducing the risks of relapse, and then also strengthening family support and communication. And then that is the end of my presentation, and these are my references to reference. And then medication is a powerful tool, but not standalone solution. So as social workers, we need to support the clients not only through medications, but also with education, advocacy, collaboration, and compassion.